So my infusion date is creeping closer and closer, and I am nervous. I would be lying if I said I wasn't. Quite nervous actually. Um, and for me, one of the ways I combat nervousness about like this kind of stuff is through research and educating myself. So go on a deep dive with me, and we're gonna learn this. So my doctor and I had discussed a few different options, and we decided that Rituximab, or what else is it called? It's called something else as well. Rituxan was the best option for me. And what that is an infusion. So instead of like a monthly injection or an oral medication, I have to go to a cancer treatment center, and I have to get an IV drip that will last many hours. They told me over the phone that the first infusion was going to be about 5 to 6 hours, and then after that, it could be anywhere from 3 to 5 hours. Yay! Being told that emotionally for me was scary, to say the least. Like, I never envisioned myself going to a cancer treatment center, sitting next to a bunch of people that are getting chemotherapy to have an infusion with them when I don't have cancer. That's fucking terrifying to think of. It's horrible because, like, if somebody tries to talk to me and ask me about this, like, how fucking rude is it to be like, oh no, I have MS and I'm getting my treatment for this? Like, it just, I'm overthinking it on so many different levels. And then, like, also, I know very little about what this drug does and what it's for besides MS, so I want to go on a little deep dive. So, come on with me. Now, before I get into the deep dive, the websites I'm using is Multiple Sclerosis Today News Today. I'm using the Rituxan website. I am using a secondary version of the Rituxan website, like going deeper into it, and I am using the NCBI, NLM, NIH.gov website, because all of them have information about this lovely infusing drug. Yay. So, like I said in every previous video, I will have the cited links in my little chat thingy. I still don't know what the fuck that thing is called. I should. But yeah, let's go. Okay, so the first website I'm going off of is multiplesclerosisnewstoday.com. So MS is a condition in which the immune system erroneously launches an inflammatory attack that damages the myelin sheath. A type of immune cell called B cells is thought to play a central role in this inflammatory attack. Rituximab is an antibody-based therapy that works to deplete B cells. It is not approved as treatment for MS, but the medication is commonly used off-label to reduce relapse risk and delay disability progression in MS patients. Which, I mean, I knew it wasn't like one of the main treatments, but he did tell me that it has been studied for quite a long time. In the US and elsewhere, rituximab is proved to treat certain blood cancers, some autoimmune diseases, including rheumatoid arthritis, ANCA-associated vasculitis, and pemphigus vulgaris, a condition characterized by painful skin blisters. Oh, I knew all of that. Okay. It is actually in phase 3 for clinical trials for RRMS and progressive forms of MS. Ooh, that's interesting. I wonder if I'm going to be part of a study for this. Okay. Learning more things. It's given intravenously or via infusion into the bloodstream. Some MS clinical trials have explored administering rituximab intrathecally or via an injection through the spine, but this is not routinely done in clinical practice. Oh, thank God he didn't offer that to me, because if he offered it to me that way, I would have been like, no. Because it is not officially approved as a treatment for MS, there's no singular standardized dosing regimen for rituximab. The most commonly used current treatment schedule is 500 or 1,000 milligrams administered via a single infusion every 6 months. That's what I'm doing. Every 6 months. Several other dosing schedules have been explored in clinical trials, including 500 or 1,000 milligrams given 2 weeks apart, with or without additional infusions every 6 months. Another dose that's been tested in trial is 375 milligrams per square meter, given weekly for 4 weeks. Okay. Some common side effects in rituximab would be infusion-related reactions, or IRRs. These typically occur within 30 minutes to 2 hours of starting the first infusion. Common symptoms of the IRRs include fever, chills, nausea and vomiting, itchiness, nasal congestion, swelling, throat irritation, high or low blood pressure, hives, headache, muscle pain, dizziness, wheezing or breathing difficulty due to spasms in the airway. Infusion reactions are mild to moderate in severity and can typically be managed by slowing or stopping the infusion and or giving appropriate treatments to ease specific symptoms. Taking anti-inflammatory medicines like corticosteroids or antihistamines prior to infusion might reduce the risk of IRRs. Okay. Yeah, he did tell me, like, there's a reason the first one was going to take so long. It's because they had to take it much slower. And he did say a lot of the side effects were going to feel like allergic reaction type side effects, and that's why I need to be monitored heavily, and I'm doing it at a treatment center. I mean, that makes sense. Terrifying, but that makes sense. Oh, this is fun. Several fatal IRRs, including anaphylactic allergy reactions and heart attacks, have been reported in patients given rituximab, usually in response to the first infusion of the medication. Woohoo! That's an anxiety lifter. Oh, that's lovely. It's recommended that the patients be closely monitored whilst receiving the medicine, and the infusion should be stopped if severe reactions occur. Oh, that's terrifying. Skin and mucosal reactions. Severe and sometimes fatal reactions of the skin and mucous membranes have been reported in patients on rituximab. Specific reactions can include toxic epidermal necrolysis, a severe skin reaction with blistering or peeling of the skin, paraneoplastic pemphigus, an autoimmune disease that mostly results in mucosal lesions, ichnoid dermatitis, a form of eczema characterized by purple-tinted raised skin bumps, vesiculobulous dermatitis, a blistering disease. Jesus, fuck! If any of these happen, the treatment should be stopped. Because if it works to lower the activity of the immune system, rituximab might increase the risk of new infections or cause existing infections to worsen. That explains why he had me reschedule when I had a sinus infection. For this reason, vaccines that contain a live virus should not be given to patients currently on or about to start rituximab. Oh, that's terrifying. In people with inactive hepatitis B virus infection, rituximab might cause the infection to reactivate, which can result in liver failure and death. Well, thank God he screened me for HBV and I came out negative. Jeebus. You see my anxiety rising already just reading this? I shouldn't have started this, but you know, fuck it, I'm committed. Let's fucking go. PML, a rare and potentially fatal viral infection to the brain, has been reported in patients on rituximab. He did tell me I ran a higher risk just from having the JCV virus and having multiple sclerosis, and now an even higher chance because this. Jesus. Okay. This is just one website, so I'm actually gonna do a couple parts to this, because, like, I need to go do some deep breathing, because I am anxious now.